If you've been online at all lately or watched the news or even just chatted with friends, there's this one topic that just keeps coming up.
hmm The new weight loss drugs.
Exactly. It feels like everyone, celebrities, tech figures like Elon Musk, they're all talking about these like miracle weight loss methods.
Yeah, the buzz is huge.
So today we're doing a deep dive. We really want to get under the hood of semaglutide. You probably know it better as Ozempic or Wegovy
Right.
because the headlines are everywhere, but there's a lot more going on than what you just see scrolling through social media.
That's absolutely right. Our goal here is to really unpack this. What are these medications? How do they work biologically? Who are they actually for based on, solid medical guidelines?
And the crucial stuff people need to know before even considering them.
Exactly. We'll be drawing on some great insights from a Youth Health Today article, specifically quoting Dr. Cecilia Lo Wang. She's an expert in endocrinology, diabetes, metabolism. She really breaks it down.
Yeah, this isn't just about losing weight, is it? It feels like it's about understanding our bodies better, how health works, and navigating these big medical breakthroughs.
Precisely. It's a bigger picture.
Okay, so let's jump right in. Ozempic, Wegovy, I hear these names all the time. Are they basically the same thing, or what's the difference?
That's a really key point to clarify right off the bat. They are essentially two brand names for the exact same drug.
Oh, okay.
The active ingredient is semaglutide, the difference. It's all about why they got FDA approval.
Right.
Ozempic was approved first back in 2017, and it was specifically for people managing type 2 diabetes.
Okay, diabetes first.
Then came Wegovy, approved in 2021. That one's indicated for chronic weight management. So for people with obesity or those who are overweight but also have another health issue linked to weight.
Like high blood pressure or cholesterol.
Exactly. And there's actually a third one, Rybelsus. That's semaglutide too, but it's a daily pill also for type 2 diabetes.
Interesting. So pill form too. But Ozempic and Wegovy, same drug, different target audience, basically.
You got it. Same core mechanism, just different approvals.
So what is that mechanism then? How do they actually, make people lose weight or control blood sugar? What's happening inside?
It's actually quite fascinating. They work by mimicking a hormone that your own body produces naturally. It's called glucagon-like peptide 1, GLP-1.
GLP-1. Okay.
Yeah, and this hormone, it does a couple of really important things. It targets areas in your brain that control your appetite.
So it dials down the hunger signal.
Exactly. Makes you feel less hungry, but it also does something else. It slows down gastric emptying.
Meaning how fast food leaves your stomach.
Precisely. So food stays in your stomach longer, which makes you feel full sooner and stay full for longer. You just naturally tend to eat less.
Wow. So it's working on both brain signals and the physical digestion process.
Correct. It's kind of like helping to reset your body's natural satiety and hunger cues, which can often be, dysregulated.
And this is arriving at a time when weight is such a huge public health issue.
Oh, absolutely. It's a massive challenge. You look at the stats in the U.S., something like 70% of adults are considered obese or overweight.
70%. That's staggering.
It is. And it's not just about the weight itself. It's the downstream effects, much higher risks for really serious problems. Heart disease, stroke, type 2 diabetes, even certain types of cancer.
Yeah, and that leads to this really interesting point. For so long, the conversation around weight felt very simplistic, almost blaming people.
Oh, definitely.
Just eat less, move more.
Yeah.
As if it were purely willpower.
Right. That was the dominant medical narrative for decades, honestly. Oversimplified, it acknowledged lifestyle, sure, but it really missed the deeper physiological story.
But these drugs seem to blow that old thinking up a bit.
They really do. They highlight what we now understand much better. There's a huge genetic component to appetite, hunger, how full you feel, your metabolism. It's incredibly complex biology.
So it's not just simple calories in, calories out for everyone.
Far from it. We now know weight gain is influenced by so many things. Genetics, yes, but also your gut microbiome, your individual metabolic set point, that complex brain-gut signaling.
And even wider things like environment.
Absolutely. Social factors, the environment you live in. These drugs, in a way, target the biology, the dysregulated physiology, as Dr. Lo Wang puts it. That makes weight loss so incredibly difficult for so many people, regardless of effort.
Yeah, it really changes how you think about it. But okay, let's talk about the hype. Social media makes it seem like anyone who wants to lose, say, 10 pounds can just get a prescription. Who are these actually for, according to the FDA?
This is so important to get right. These are not intended for casual or cosmetic weight loss. The FDA criteria are very clear.
Okay, let's hear them.
For Wegovy, the one approved for weight management, you need a body mass index, a BMI of 30 or higher. That's the threshold for obesity.
BMI of 30 plus, okay.
Or you could have a BMI of 27 or higher, which is overweight if you also have at least one health problem related to your weight.
Like the ones you mentioned, high blood pressure, type 2 diabetes, high cholesterol.
Exactly those. And importantly, Wegovy is also approved now for kids and teens ages 12 and up who meet the criteria for obesity.
Okay, and Ozempic.
Ozempic's approval is strictly for people with type 2 diabetes. That's its labeled use.
So really specific medical needs.
Very specific. And Dr. Lo Wang in the article raises real concerns about what's called off-label use.
Meaning people using it who don't fit those FDA criteria.
Correct. Now, a doctor can legally prescribe a drug off-label if they believe it's medically right for that specific patient. But the worry is widespread use by people who just want to slim down a bit.
Why is that a worry?
Well, a couple of reasons. It raises serious questions about access for the people who truly need these drugs for diagnosed obesity or diabetes. Think about supply shortages. And it brings up issues of health equity. Are these powerful drugs going to those with the greatest medical need?
Right. Access and equity. That makes sense. So, okay, if you are someone who might qualify or you're thinking about it,
Yeah.
what's the catch? What's the fine print we need to talk about?
Ah, yes, the fine print. And there definitely is some. Dr. Lo Wang outlines about 8 key things people really need to consider carefully.
All right, let's go through them. Number 1.
Number 1, we just covered it, but it bears repeating. Not for everyone. Only for those meeting the specific medical criteria. Not for vanity pounds.
Got it. Number 2.
This is a big one. It's likely a long-term commitment. For most people, you need to keep taking these drugs indefinitely to keep the weight off.
Indefinitely. Wow.
Yeah. Dr. Lo Wang notes that if you stopped, the weight tends to come back, often quite rapidly. You might regain most, if not all of it.
Okay, that's crucial. What's number 3?
High cost and tricky insurance. These meds are expensive. We're talking over $15,000 a year without insurance coverage.
15,000.
Yep. And many insurance plans don't cover them specifically for weight loss, even if they cover them for diabetes. It's a huge barrier.
That's a massive access issue right there. Number 4.
Shortages. Because they've become so popular, there have been real problems with supply chains keeping up. Availability can be inconsistent.
Which is especially tough for diabetics who rely on it. Okay, number 5.
The side effects, particularly gastrointestinal side effects, these are pretty common.
Like what?
Nausea is a big one. Also diarrhea, vomiting, constipation, stomach pain, sometimes headache, fatigue, indigestion, dizziness, bloating, gas. It's quite a list.
Sounds unpleasant.
It can be. Doctors usually start you on a low dose and increase it slowly over weeks. That's called dose titration to try and minimize these. But even then, Dr. Lo Wang mentions about 1 in 5 people stop taking the medication because the side effects are just too much.
1 in 5. Okay. Number 6.
A specific risk for certain people, retinopathy risk. This applies mainly to individuals who have diabetes that isn't well controlled.
Retinopathy, that's eye damage, right?
Yes, damage to the blood vessels in the retina. In studies, a small percentage of people with uncontrolled diabetes developed new or worsening diabetic retinopathy.
So if you have diabetes, checking with an eye doctor is critical.
Absolutely essential.
Yeah.
Regular eye exams are vital before starting and while taking these drugs if you have diabetes.
Good to know. Number 7.
It's not just the drug. You still need lifestyle changes. While the meds help suppress appetite, achieving and maintaining weight loss long-term still requires effort. Reducing high sugar, high-fat foods, getting regular exercise, that's still part of the equation.
The drug is a tool, not a total replacement for healthy habits.
Exactly. And finally, number 8.
Number 8. You might have heard people talk about Ozempic face.
Ah, yes. That gaunt look.
Right. People losing fat in their face, maybe looking older.
Dr. Lo Wang suggests this isn't likely a specific effect of the drug on the face. It's probably just a result of losing a significant amount of weight overall, sometimes quite quickly. Your face changes when you lose substantial weight, regardless of how you lose it.
Okay, that makes sense. That's a really important list of 8 things. Are there any other, maybe rarer, but more serious risks people should know about? Specific health conditions.
Yes, definitely a few more serious points. There's an increased risk for pancreatitis, that's inflammation of the pancreas. So if you have a history of pancreatitis, these drugs generally aren't recommended.
Okay, history of pancreatitis is a no-go.
Right. Also, they should not be used if you have a personal or family history of something called MEN2.
No.
Multiple endocrine neoplasia type 2, it's a rare genetic condition, or if you have a history of medullary thyroid cancer. Those are contraindications.
Got it. Serious conditions to be aware of.
Which really just hammers home the point. You need a thorough, honest conversation with your doctor about your entire health history. Your primary care doctor, any specialist, definitely your eye doctor if relevant.
And presumably ongoing monitoring.
Oh, for sure. Regular checkups, yearly eye exams are crucial anyway, but especially here. Blood tests, urine tests, keeping an eye on kidney function. It's about managing your whole health picture safely.
So it sounds like you start this journey with close medical supervision. What if someone starts and then decides to stop? Maybe the side effects or the cost or something else. Is there a special way to stop? Do you taper off?
Actually, no specific tapering schedule is required to stop taking them. You can just stop.
Okay.
But, and this is a huge but, you need to be prepared for the likely consequences.
Which are?
The very high probability of regaining the weight you lost. And if you were taking it for diabetes, your blood sugar control will almost certainly worsen.
Because the underlying issue is still there.
Exactly. As Dr. Lo Wang says, whatever you were treating is likely to recur. The medication was managing the symptoms or the physiology, but stopping it means those underlying conditions come back to the forefront unless significant, sustainable lifestyle changes have been made and maintained.
That really drives home the long-term commitment point again. It's not a cure, it's ongoing management.
Precisely.
But on the flip side, we have to acknowledge, despite all these cautions, for the people who do fit the criteria, who do need these medically, the benefits can be enormous.
Oh, absolutely enormous. Life-changing, potentially. The average weight loss is around 12% of body mass. That's significant.
And what does that 12% weight loss do for overall health?
It triggers a whole cascade of positive effects. Even losing just 5 to 7% of your body weight can dramatically lower blood pressure and significantly reduce your risk of heart disease and stroke.
Just 5%. Wow.
Yeah, and when you get up to that 15% loss range, which many people on these drugs do achieve, you can see even more profound changes.
Like what?
Like type 2 diabetes remission. Actually putting diabetes into remission, Dr. Lo Wang calls this huge. Given how strongly diabetes is linked to heart attacks and strokes, that's a massive benefit.
Incredible. Any other health improvements?
Yes, lower cholesterol levels are common, and they're proving effective for treating fatty liver disease.
Which is becoming more common, right?
Very common. And Dr. Lo Wang makes a fascinating point. Fatty liver disease is now the leading cause of cirrhosis, needing liver transplants. People often think cirrhosis is mainly from alcohol, but non-alcoholic fatty liver disease is a huge driver. These drugs can help treat that.
So the benefits go way beyond just the number on the scale.
Mm-hmm.
It's deep metabolic health improvement.
Exactly. Which is why Dr. Lo Wang strongly advocates for better insurance coverage for these meds for the patients who meet the criteria. She sees it as an investment.
An investment in preventing future problems.
Right. Preventing costly complications down the road, heart attacks, strokes, kidney failure, liver transplants. It's about long-term health and, importantly, health equity, making sure people who need it can actually access it.
That makes total sense. Okay, so these are powerful tools, but what if they aren't the right fit for someone? Maybe the side effects, the cost, or they just don't qualify. What are the other options for weight management or diabetes?
Great question. There are definitely other effective routes. For type 2 diabetes, there's another important class of drugs called SGLT2 inhibitors.
SGLT2, like Jardiance, Farxiga.
Exactly. Those also help with blood sugar control, and they often come with weight loss benefits and significant heart and kidney protection. So they're excellent options for many people with diabetes.
Okay, other medications. What else?
For significant weight loss, bariatric surgery is still a very effective, well-established option for patients who qualify. It can lead to substantial and crucially sustainable weight loss.
Right, surgery is a major intervention, but effective.
Very effective for the right candidates. And of course, we shouldn't forget comprehensive lifestyle programs, working with dietitians, exercise physiologists, sometimes psychologists, developing personalized strategies focused on nutrition, activity, and behavior change. Those are always fundamental.
Lots of avenues to explore with a healthcare team.
Absolutely. It's about finding the right path for the individual.
So wrapping this up, this deep dive really highlights that Ozempic, Wegovy, Semaglutide, they're clearly powerful medical advancements, but they are absolutely not simple magic bullets. They represent a major shift, though, in how we understand and treat chronic conditions like obesity and diabetes, acknowledging the deep biology involved.
That's the key takeaway, and Dr. Lo Wang's advice really sums it up. See your provider, talk it through honestly, understand the side effects, be realistic about the costs and the fact it's likely long-term unless insurance coverage improves significantly.
And remember who they're for.
Critically.
Yeah.
For people with type 2 diabetes, these GLP-1 drugs offer huge benefits, blood sugar control, often without causing low blood sugar, plus heart protection. But for generally healthy people just wanting to lose a few pounds, they're simply not indicated, not appropriate.
It's a nuanced picture.
Yeah.
Which leaves us with maybe a final thought for you, our listener. This whole conversation shows how science keeps pushing us to rethink old assumptions, right? Even about something as basic as weight. It kind of makes you wonder, as our understanding of complex conditions like obesity keeps evolving, what other things we think of as simple truths today might medicine completely redefine in the years ahead?
That's a fascinating question to ponder. The landscape is definitely changing.